This is infection part 2. Once the pathogen has gained entry into the individual, the development of an infection progresses through stages. The first stage is the incubation period. This period represents the time between the entry of the pathogen into the body to the onset of non-specific signs and symptoms. It is during this period that the pathogen is actively multiplying within the individual. The length of incubation period varies on the organism. An example of a short incubation period is a staphylococcal food poisoning with an incubation of about 30 minutes. On the other end of the spectrum are long incubation periods, such as hepatitis B, whose incubation period can be 60 to 180 days. It is important to remember, during the incubation period, the person may be able to transmit the disease to someone else. To continue on with these stages, please go to the next slide. The prodromal stage, or period. The prodromal period begins when the pathogen has multiplied to sufficient numbers that it begins to cause signs and symptoms. This period is from the time of onset to non-specific symptoms until the specific symptoms of the infectious process appear. Vague symptoms such as fatigue, malaise, elevated temperature, and irritability. Individuals have increased white blood cell counts, and because the symptoms are general, no disease-specific precautions can be taken to prevent the spread of the illness. This stage can last from a few hours to days. Examples include chickenpox, which are 24 to 48 hours, and pertussis, which is up to a week. During the acute phase of the illness, this is where replication and numbers of the pathogen have reached the maximum point. Specific symptoms related to the pathogen occur and can either be localized or systemic. This is the time the physician will be able to provide a better diagnosis based on clinical manifestations. Severity of the illness is independent on the susceptibility of the individual of the pathogen. The convalescent period extends from the time of acute symptoms disappearing until the person returns to their normal state of health. This can range from a few days to months. The convalescent period is always much longer than the person anticipates. And finally, the resolution period. This is the total elimination of a pathogen from the body without any residual signs or symptoms of the disease. Virulence factors are substances or products generated by the infectious agents that enhance their ability to cause disease. There are 3 groups of these. Toxins, which include endotoxins and exotoxins, which we discussed earlier under bacteria. Adhesion factors, these help the infective organism to stick to the body, specifically the host cells, so that they can colonize in the host. And evasive factors, these help keep the immune system from killing the infective agent. These factors in some cases protect the organism from phagocytosis, while other organisms produce evasive factors that confuse the individual's antibody into thinking the organism is friendly and should not be destroyed. Diagnostic tests include blood tests, culture and sensitivity, and serology. Blood tests provide healthcare workers with general information about whether an individual has an infection. The tests themselves do not provide a definitive diagnosis, but rather confirm that an infection is present. Culture and sensitivity. These techniques are important for determining appropriate antimicrobial therapy. Specimens of blood, sputum, or urine must be collected before antimicrobial therapy is started. The idea is to match the bug to the drug. Once the specimen is collected, it is spread on a bacteria-growing medium and allowed to grow. This usually takes 48 to 72 hours. The culture plate is then examined to determine what type of microbial is present. Once the microorganism has been identified, small antibiotic-soaked discs are placed into the culture. Many different antibiotics can be tested on the bacteria at the same time. The idea is to see which antibiotic will be most effective against the bacteria. Here's an example of a culture and sensitivity report a physician would receive. The specimen was urine. The organism was Enterococcus pharsalis, and then it lists the antibiotics it is sensitive to, meaning these antibiotics would be effective against the organism. It also shows that this organism is resistant to streptomycin and tetracycline. Finally, serology. Serology is an indirect means of identifying infectious agents by measuring serum antibodies in the affected individual. After the individual is exposed to an infectious agent, the body produces antibodies. The antibody titer, which can be measured in the blood, rises. Identification is not as accurate as culturing for the organism, but titers are helpful in diagnosing some infectious diseases such as hepatitis. The body produces specific antibody types known as immunoglobulins during different stages of the infectious process. Immunoglobulin M, or IgM, usually rises and falls during the acute stage of an infection. Immunoglobulin G, or IgG, also rises during the acute stage of an infection, but it remains elevated into the convalescent stage. Antimicrobial therapy. Many infections individuals experience do not require drug therapy. The body's defense mechanisms are activated and the organism is isolated and destroyed. There are some instances where antimicrobial therapy may be needed to help the individual's immune system fight off the infection. Drugs used to treat bacteria and viruses work in different ways. Antibiotics, which are used to treat bacterial infections, will not work against viruses. There are several classifications of antibiotics. Each classification works against bacteria in a different way. Antibiotics kill bacteria by targeting one or more of the following: by blocking synthesis of a bacterial wall cell, by interfering with bacterial metabolism, interfering with protein synthesis and reproduction, and by interfering with nucleic acid metabolism. Antiviral agents decrease the production of the virus within the host cell by one of the following methods: by blocking viral RNA or DNA synthesis, by blocking viral binding to the cells, or blocking production of the protein coats or capsids of the new viruses. As you may have read in the newspapers, there are some bacteria that are resistant to current antibiotics. The bacteria accomplish this by changing the antibiotic binding sites, using different metabolic pathways, and changing their walls to keep antibiotics out. Drug-resistant bacteria can be a problem when a patient develops an infection and there is no antibiotic available to treat it. There are some recommended guidelines for antimicrobial therapy to reduce further development of drug-resistant bacteria. First, the drug should be taken as prescribed. If it says 3 times a day, then it should be taken every 8 hours to maintain a level of the drug in the blood. Then the drug should also be taken until it is completed. This is to make sure the organism has been completely eliminated. Of course, if the individual experiences an adverse reaction, they need to stop the drug immediately and call the physician. But many individuals feel better after a few days and stop taking the drug. This increases the risk of the development of resistant organisms. Finally, drugs from previous infections should not be used for a future infection unless approved by the physician. This is because the drug may not be effective against the organism causing the new infection.